I promise starting next week I'm going to get into a ton of true obstetric and gynecology content because I realize I've been doing a lot of like mindset stuff, which frankly I love, but I'm here to do clinical stuff too. Today though, I do want to talk about the Dr. Google because I feel that sometimes I'm a little bit disparaging of the doctor and I shouldn't be, but I want to highlight what I mean when I say don't Dr. Google. First of all, let me just say Google. I'm deeply appreciative of Google as a platform. I use Google every day. I have to search things every day like everyone else. Of course, I know they are watching me and following me like everybody else. We've just unfortunately succumbed to that. I do think that unfortunately, because when you search for something, it is unmodulated. As we've said before, when people say things to us like, I've done my research, what they really mean, even though they don't say it, is I have Googled other people's opinions, maybe other people's actual research, but doing your research means you're actually doing the research, which I don't even do the research. I don't have the ability to do the research. I am a medical professional who practices in my office. I do not perform research, nor do most of you, which is okay. But let's be clear about what we're doing. And it came up because in my office, I see these things every day, every week, several times a week. Now fewer times a week since I'm in the office less. But a patient and I had a discussion and we were talking about a potential outbreak of HSV1. So herpes 1, which just to give you the background again, HSV1 tends to be oral herpes, HSV2 virus, those are my dogs, sorry, tends to be genital herpes. There can be cross reaction, meaning many people can get HSV1 virus, which is the name of the virus, and instead of getting it orally, like cold sores, they can get cold sores genitally, and then it's still called genital herpes, even though it's from the HSV1 virus, which is traditionally considered oral herpes. I say that because there's still so much miscommunication, misunderstanding, disinformation, and frankly, fear when it comes to herpes. Hence the reason I will be doing much more content on herpes. In this particular case, this patient had a kind of nebulous story, meaning she presented, like many people do, with a lesion. When we say lesion, we just mean like let's say you had a little cold sore or an ulceration. That's a lesion, okay? Lesion takes on many different terms in the medical vernacular, but in this case, a herpes lesion would be a cold sore here or a cold sore genitally. Interestingly, herpes can also cause lesions or ulcerations or cold sores, not necessarily on your vulva or on the shaft of your penis, but in the skin in the area around it. Even as far as your buttocks, your thighs, the inside part of your legs. So sometimes it's a bit confusing. Was it an ingrown hair that you scratched? Was it a mosquito bite? Many of you may remember, if you followed me long enough, that I remember our sweet patient who said, every year I get a spider bite exactly in the same spot on my buttocks. And I had to be the one to tell her, actually, that's a herpes lesion. Now, in her particular case, and in many cases, herpes lesions, again, that are on your buttocks, on your vulva, on your penis, on the thighs of your inside between your legs, even if it's not technically genital, it can be from HSV1 or 2, and we kind of classify it as genital herpes. And in our world, when you're dealing with obstetrics, you care about it because the baby, as he or she is coming out of the birth canal, can get exposed to a larger dose of the virus that can be shed from those little lesions. And the baby, even if the baby has had antibodies through mom's circulation, it's not enough antibodies necessarily to stop the baby from getting a herpes infection. And that's why we care very much about herpes. We know herpes is very rampant. It's incredibly common. And that's why we instruct people to take valcyclovir or acyclovir, which are the antivirals. They take them starting at about 35 or 36 weeks of pregnancy prophylactically, meaning preventatively, to prevent an outbreak at the time of the delivery so that they don't have to have a C-section. Now, let's nugget through that. HSV1 tends to be oral, but it's very common that you can also get it genitally. When I say very common, it seems to be on the rise. Good news being that when you have HSV1 genitally, it tends to be less recurrent, we think, than HSV2. Second thing to note, HSV in general is common, and if you have an outbreak at the time of labor, because that's when your body is under more stress, then simply put, nothing horrible, but you would need a C-section. So how do we prevent that? Is prophylactically giving anyone who's had any lesions, longer background about it, but you should talk to your doctor if you've had any herpes lesions genitally, because then you would take prophylaxis from 35 or 36 weeks on. And again, it's genital, whether it's HSV1 or 2. Now, in this particular patient's case, she had her very first outbreak, meaning she had no knowledge that she had herpes, and she had this lesion in her thigh, essentially. It was not something that I saw. It was described to me in my practice. It sounded like it could be herpes, and the net effect was that we all agreed that it would make most sense for her to take the valcyclovir prophylactically in this pregnancy to prevent an outbreak so that she can deliver vaginally. Now, here's where I talk about the Google. She was really appropriate and said to me, well, I Googled herpes, and that was my first outbreak. And what I Googled is that probably it wasn't herpes, because Google says that your first outbreak is going to be really painful and a lot of different spots, and you're going to feel globally sick, and it's going to probably recur and take longer to resolve. None of those happened in my case. I had that one spot, and it went away within a couple days. To which I responded, you are correct that that might not have been herpes, but this is a perfect example of how and why Google can take us down the wrong path. And it's not Google's fault. It's any search engine or anything that you read without someone appropriately modulating it to you. Herpes is confusing. Herpes has what is called a primary outbreak. A primary outbreak is very specifically defined as you were just recently exposed to the virus, right? Either through genital contact or oral contact, you were exposed to the virus, and within a couple days or max a couple weeks, you had your body's response to it, which showed up not just as creating antibodies, but actually as a herpes infection where you had multiple lesions, general flu-like illness sometimes, lymph nodes. And again, that will be the worst outbreak for anyone who ever has had an outbreak. And that is a primary outbreak. Now, here's where it gets confusing. You might never have a primary outbreak. Many people, in fact, probably the majority of people, get exposed to herpes asymptomatically. They don't know it. They have no outbreak. They have no primary outbreak. Their body sees the virus, creates antibodies against it, keeps some of the virus on their skin or in their mucosa, and they can shed the virus. And then at some point in their life, maybe, like when they're 50, 60, 70, 80, 20, 30, any age, they will have what they say is, oh, this is the first time I've ever had it, right? Their first time that they've had it, but they were exposed a long time ago, is not a primary outbreak. So you see how it's confusing. Again, a primary outbreak is very specifically timed as recent exposure and a much more significant presentation of the illness, okay? You'll never have a primary outbreak more than once, and you very well might carry herpes and have your first outbreak, which means your first one little sore, and it's not a primary outbreak. But you see how that would be confusing if you just read about it. And you see how this patient very innocently and very appropriately said, I don't think it was herpes because what they described is not what I had. So all this to say, I hope you learned about herpes. I hope you understand why we as doctors say just don't Dr. Google it, because it will undo some of the information we're giving you. We're trying to give you very good information to the degree that we can. Does every doctor do it? No. Does every doctor do it well? No. Do some doctors talk too much and confuse you? Yes. But we're trying, and if we don't do a good job, then ask us to clarify, as opposed to merely believing what is read the way it's read, okay? Same example I often give is, if you look up, I have a headache, what could it be? Well, the Google is going to tell you, it could be dehydration, it could be a lack of caffeine, it could be you need new glasses, it could be allergies, it could be a tumor, and it could be an aneurysm. All of which are true. But when you see them all equally weighted, now you're thinking, I didn't have my caffeine, but I'm pretty sure I'm dying of a brain aneurysm. When in reality, your doctor would say, well, did you have your caffeine? Are you dehydrated? Did you have allergies? Did you get new glasses? And in your doctor's mind, she is actually ruling out an aneurysm, and she's actually ruling out a brain tumor indirectly by assessing the likelihood, your risk factors, maybe certain physical things that she's netted out from you. So she can do that without listing them to you, okay? So that is my little ditty about the Google and about the herpes. So I did a 2-for-1 there, people. Okay, enjoy your night.